Broadcast is now starting. All attendees are in listen-only mode.
Hello, hello, everyone. Good afternoon. This is Kirsten, and you have joined the webinar for provider expectations and responsibilities around COVID-19 and, frankly, also the wildfires. If everyone could please raise their hand to let me know that you can hear me, I'd appreciate it. Uh-oh, I'm not seeing any hands being raised.
Unmuted.
Oh, there we go. A couple. There we go. I think people just needed a second to get going. All right. It is just now 2:02, and as you all know, I like to get started fashionably late and give everybody a few minutes to get online. So now that I know that our sound is working, I'll remind everybody that you are in presentation mode. And what that means is you can hear us, the presenters, but we can't hear you, and blessedly, you can't hear each other. So we don't have to worry about background noise, but that means if you have a question, what you need to do is type that question into the questions section of the webinar, so of your webinar form, and if you'll type a question in, we will be able to respond and answer. Allison, can you speak?
Hi, yeah, can you hear me now?
We can, Allison. Great, thank you. Hurrah!
Hurrah.
All right, so we're just going to give everybody just a few more minutes to get on. There's only 17 attendees today, and we have several more people than 17 registered. So we're going to go ahead and give everybody just a minute to get on. All right, folks, welcome to the webinar. Today is the 15th of October, even though it says the 13th, I am wrong. And we're going to get started right away today, reminding you about webinar etiquette. Remember that you're in presentation mode, and that means that you cannot hear each other and we cannot hear you. You should be able to hear us through your computer speakers. If you have a question, go ahead and type that into the question section of your sidebar. We will get to it in the order in which it was received. And it's great. It helps us a lot to make sure that we're answering questions in a way that makes sense. If you'll phrase your question like this: what is the topic? What is the setting? And then what is the question? For example, if I have a question about masks, I would type in masks. And if I'm an adult foster provider, I would type in adult foster, and then I would ask my question, like, do I need to wear a mask over both my mouth and nose? And then we can answer that question. And while the question I just used as an example is yes, in all settings to keep people safe, you wear your mask over both your mouth and your nose. Sometimes questions are different depending on the setting. If you have a really specific question that really needs to be answered outside of this public forum, go ahead and submit those questions to this email address. I'm going to give you a second so that you can screenshot this email address. You're basically watching TV. This is a live presentation, but it's not a web page, so that is not a clickable link. So go ahead and screenshot that, write it down, or type it up elsewhere. If you're interested in signing up for our upcoming webinars, you can find those here. Again, this is just a picture of a screen. It's not a live link, but you can screenshot it, you can copy paste it, you can type it down, or you can write it down. Or Kathy is wonderful, and she is typing these into the chat section. Thank you, Kathy. You're amazing. All of the resources that we are going to be talking about can be found on this main page here. As we go through, each specific resource will be highlighted during the speaker while they're talking. For example, masks. Rose, can you unmute and talk to us a little bit about masks and supporting individuals in residential settings?
I would be very happy to. So again, I just want to reaffirm and enforce the importance of mask wearing, especially in 24-hour settings when there is going to be, or foster care, when we have caregivers who don't live with the individual. When there is direct care being performed or we cannot maintain physical distancing of at least 6 feet, masks need to be worn. Super, super, super important. And also when we're wearing masks, we mean using them properly, covering the mouth and the nose. We've had folks in homes and they're like, yeah, we've got masks, and masks are hanging on someone's neck, or maybe they're just over the mouth. We need those masks to be worn and to be worn over the nose and mouth when we're providing that direct personal care or we're not able to maintain that physical distancing. This is also super important because another thing that we're considering, and I want to mention here, is we are looking at more flexibility with visitation, seeing the importance of having family and friends involved. And we realize that some people, especially in those counties like Multnomah County, for example, that's been in that phase 1 for a really long time, and we want to give that extra allowance for visitors and for people to have those interactions, but we need masks to be worn. So that'll be one of our criteria that we have as we look at visitors coming into the home. If we have a visitor in the home, we want to see masks being worn by everybody whenever possible. Even when there's physical distancing, if a visitor's present, we want those masks worn. So if I can't say it enough, please wear the masks. We need the masks worn. Masks are very, 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 very important. And then I also wanted to talk a little bit about this concept. When we kind of roll things out, it seems like COVID happened, we're learning things, you know, and then we hear this term new normal, which a lot of us cringe at, but it kind of is. And when we talked about masks originally, we have been allowing for an accommodation when there's a negative behavioral reaction. So if there's like a triggering of a challenging or dangerous behavior, we certainly don't want the masks to become an issue where it actually increases a risk to someone and their safety. But we want to start thinking about the longevity of how long now masks are being used for the foreseeable future at this point. And really that public and community response of masks are expected in any community setting, really. If there's other people, there's masks being worn. And when we start thinking about that, we think of, and rather than it just being an accommodation, how do we help support people so that that masks or that intolerance of masks is not a barrier to their access to the community. And so we really want people to think about, if we're using that accommodation option because somebody has that negative reaction to the masks, the team leads think about what can we do to really help get to the point where the individual is able to or will tolerate others wearing the mask. It doesn't necessarily mean that we're using formal behavior supports, but it's more about we're really taking our skills and our knowledge and what we're learning day by day with this pandemic, as well as what we know about the individual, and what are positive things we can do to help that person. Maybe it's cueing, is it social stories? ODDS has a Powtoons video about wearing masks, which would be a great resource to show people. Positive reinforcement, modeling, you know, we show that we wear a mask, and you know what, I know some people have strong feelings about them, but if we can show that wearing masks is a doable thing and everybody around us is doing it, that's important. We can expose people to wearing masks. So maybe we're going places where we have that distance, but they're able to see, hey, look, everybody you're seeing walking out there, they've got masks on. This is the thing to do. You know, we're going into maybe the parking lot of Walmart and we're saying, look, everybody who goes into Walmart, they have to have that mask on. So people are understanding what that expectation is and they're seeing it. Maybe there's some desensitization we can do, such as we're just going to try one on. Maybe there's a certain fabric that you like or a certain style. Maybe it's going to be more of that gaiter versus that mask that goes over your ears. Or maybe I don't like it touching my ears. Maybe I have one of those masks, and people are getting so creative. I have some type of Velcro that helps hold the mask at the back of my head instead of over my ears. All those kind of things. You know, what can we see where people are wearing those? Maybe it's a mask challenge of, you know, let's see how long we can last. Let's use an egg timer and try for a minute or 5 minutes this time. How do we help people understand why we're wearing a mask? That's super, super important, as well as them understanding it can be a barrier. A business can refuse someone to come into their setting if they don't have a mask on. Businesses can accommodate by delivering to cars and doing those sorts of things. But if someone wants to go into that business and go into those places and be a part of their community, we have to get used to wearing a mask. It's kind of like, you know, wearing clothes. You know, there are going to be people who have sensory aversion and who don't like clothes, but we have to teach people to wear clothes so that we don't get arrested in public, you know, and we're not really arresting people over masks, but businesses are refusing entry and masks become a safety issue, and it is a normative practice right now. So how do we help people kind of get on board with what's out there? Because we're introducing something new in people's lives. Another really cool idea that was just mentioned to me and I thought was really neat too is sometimes it's about making it a fun thing. It's about self-expression. How do we make this mask be a positive thing? Is there a theme, a favorite character, a favorite sports team? Can we bedazzle our mask? Something that makes that really positive. So when somebody goes and they're like, I want to wear my mask because it actually represents me and some things that are important to me. And I'm actually excited to go and show it off when I go to the store. So again, these are just ideas and strategies, but we really want to think about how do we help people get to the point where they can tolerate and wear masks and structure activities to where maybe it is only a limited amount of time, but we're helping them get there. So that's really what we want to see and think. And I would really ask teams to problem solve and come up with plans and ideas so that we help people again in that community integration and that community access.
Hey, Rose, speaking about gatherings and getting together with people, what is the guidance and has there been any change in guidance around gathering outside with others, like at a park, for example? How many people in a group is safe? What is ODDS guidance around that?
Okay, so I believe in everything that we are doing, we always have to defer to the governor's directives and those orders, public health orders. My understanding is the July orders that limit gatherings to less than 10 indoors. And outdoors, I'm not recalling a specific number, but I do know that there is physical distancing requirements. There might be some number gatherings that depends on the municipality where someone lives as well. Again, we always want to think about, are we able to physically distance? Are there adequate resources for people to maintain safety in those protocols in those settings?
Thank you, Rose. Next up, Allison would like to talk a little bit about employment and DSA. And in this case, you'll see that the specific resource, the worker guide specifically for reopening employment and DSA, is listed here. Allison?
Hi, thanks for unmuting me. I don't have access to that on my phone, but anyway, can you hear me now?
We sure can.
Great. We updated the employment and DSA temporary emergency reopening COVID-19 reopening plan worker guide on September 29th. As Kirsten said, there's a link to it on the screen. And what it includes, the key pieces is that we are now saying that discovery is permitted during phase 1 if a provider has an ODDS approved reopening plan that addresses discovery services specifically. Some providers have already submitted those to ODDS for review, and we're getting back to them with those approvals. but we're also just in general trying to encourage providers to get their reopening plans in, even if they aren't necessarily planning to open and make that service available in the immediate future, but get that plan in so that they can have it in place when they do resume those services. And along with discovery, we also said in the worker guide that during phase 1, employment and DSA providers may also deliver one-to-one employment services or DSA services at a provider site with an approved reopening plan as well. So a lot of this really impacts the Portland metro area and increasing or expanding services a bit more in that area for folks. So that's the biggest piece of the worker guide. There were some other smaller updates, but I thought maybe I'd pause there, see if there were any questions. Some of the other smaller updates include, clarifying that employment and day service providers should make sure that they have relevant risk mitigation strategies in place, even if the service is being delivered remotely. And then still keep the risk mitigation strategies in place for the in-person services if and when services change and services start to be in person. We did add some information about employment service providers or supporting people if needed to pursue claims for unemployment insurance. And so to try and streamline some of that, the employment department has asked us to have our providers complete a certification, and then they can speak directly with you as you're supporting people to make those claims for unemployment insurance. And
Allison,
think
if an agency has been open the entire time, they didn't shut down, like they provide job coaching and they never shut it down, they never shut down. Do they still need to submit a reopening plan?
They don't for job coaching services. It was just a reopening plan is required for any group-based services or services at a provider site or discovery services. So one-to-one job coaching or one-to-one DSA in the community would not need a reopening plan, but all the other employment and day services would. And so there are some instances where providers, due to certain exceptions, there was some small group that was in an essential business that did continue even though it was more of a group-based service. They did still need to submit a reopening plan. But yeah, so if it was one-to-one, if it was job coaching or one-to-one DSA in the community, they do not need to have a reopening plan.
Thanks, Allison.
Mm-hmm. Yep, and
I don't think you have any other question.
Okay, sounds good. And that was, I think, all that I was going to cover on the reopening plan guide. So thank you.
Next, we're going to talk a little bit about the incident management team meeting form. And while this doesn't really have anything to do with COVID, and it has nothing to do with the wildfires, it was a pretty big policy that went out recently. And so we made the decision to go ahead and have that conversation here. Our rules require that every case management entity, every CDDP, and every brokerage submit a summary of the incidents that have occurred, the serious incidents that have occurred, as well as abuse that has happened, and have a conversation around what that means, if there are any trends, and then report that back on an ODDS approved form on a quarterly basis. And then 2020 happened and the form didn't ever go out. 2020 was hard, I say was as if it's somehow over. It's not yet. So 2020 has been hard on all of us, and we finally got the form out at the end of summer. But it quickly became evident that the level of trend analysis that we were asking was beyond the abilities of CDDPs and brokerages at this point in time, because 2020. So we reissued that action request with a much more reasonable amount of data analysis. Darlene's team, Josh, is very, very available to provide technical assistance to CDDPs and brokerages so that they can get the information they need to have the meeting out of CAM, out of the centralized abuse management system. Are there any questions about the new form or the history of the new form? Okay, like I said, it's a much more straightforward form that we're asking for. Great, so with that, I will move us right along to wildfire-related temporary housing. Mike?
Okay, so yeah, real quick. Yeah, as the wildfires started spreading and evacuation orders were being given, it became clear pretty quickly that some people in our services, just the standard shelters that were put up, by Red Cross and such organizations like that, just would be very detrimental to some of the people that we serve. And so, recognizing that, we started a program that would pay for temporary shelter for people who needed it. These are for people who are in-home services or children's foster care only, though. The program is managed by the CDDPs and brokerages. They're the ones paying for hotels, essentially is what we're talking about, hotels for people who have been displaced. And we reimburse them. So if you happen to know of somebody who has been displaced because of the fires and doesn't have safe shelter right now, please alert the case manager because they may be able to help. I think in a nutshell, that's it.
Thanks, Mike. You did such a good job. There are no questions. All right, so now we're going to talk a little bit about the replacement of items that were lost or missing due to having to evacuate from the wildfire. So if you're aware of an individual who has had to evacuate, and in that evacuation process, they either lost, it was ruined because of the fire, or they left behind and lost an item that was previously purchased through ODDS funds, we have created a system where the CDDP or brokerage could replace that previously purchased item. All right, I'm going to move us right along and talk about air purifiers. So the air quality over in September was pretty horrendous. And we had to identify that a lot of the people we serve would be pretty negatively impacted by such poor air quality. And so we created a program where the individual could request an air purifier and one replacement filter through their CDDP or brokerage. So if you're aware of an individual who was in that situation, then this would be the program that they could access through their CDDP or brokerage. And it's me again. So there was recently, we're going to take a strong right-hand turn away from wildfire discussion, and we're going to talk about abuse language. Otis recently amended their rules to change the definition of verbal abuse. The definition of verbal abuse also includes, sign language and augmentative communication. And so neither sign nor augmentative communication usually is an uttered thing. It's not usually verbal. Their language in the rule does indicate that a person can be verbally abused even if they use sign language or augmentative communication. Mike, would you talk a little bit about attendant care in a hospital setting?
Sure. So recently, last March, the U.S. Congress changed the law that had been prohibiting us from providing services in an acute care hospital. So that an acute care hospital now is a setting where we can provide attendant care type services. From a provider perspective, it's important to understand that not everybody in our services automatically qualifies. The legislation was very clear that whatever services, whatever home and community-based services, our services, DD services, are provided in a hospital setting, they cannot substitute what a hospital staff would ordinarily do. So when we boiled it down, it turned a person in our services would have to have some sort of challenging behavior that interferes with their ability to get medical care, communication issues that prevent their ability to get quality medical care, or very complex care needs that a hospital staff just wouldn't be able to meet. So if you think a person you're providing services for might need that sort of specialized developmental disability care in a hospital setting, know too that it has to be authorized in an ISP. It's not, like I said, it's not guaranteed for everybody, but if it's authorized in an ISP, the hospital setting specifically is authorized in an ISP, then yeah, make sure that it gets on that ISP. So what we have recommended is that for each annual plan as it comes due, that there should be a discussion among the ISP team, assuming the individual is okay with this, that for a person who might benefit from that sort of care in a hospital, that be discussed at the annual ISP and it be added to the annual ISP. If it's going to come up before at the next annual ISP, reach out to the case manager and make sure it's added as part of a change form to a person's ISP. Does not require any sort of exceptional approval from us. It's just a ISP team decision. We're only talking about attendant care. When I say attendant care, that's not limited to in-home people. It's people in 24-hour residential, foster care, every type of residential setting. A person living in any type of residential setting is eligible for this service, but it does not include things like day support activities or professional behavior services, just talking about the sort of personal care, ADL, IADL sorts of supports. It's only for acute care medical hospitals, no other sorts of institutional settings, not nursing facilities, not the Oregon State Hospital, places like that. What this means for providers really when it comes to Express is just that you can make a claim for a day of service when a person is in a hospital. It doesn't count against those 21 days that a person's outside of the home. If you are a DSP listening to this, or if you're a manager or an administrator who's going to be communicating this to the DSPs, please remind them that they are not able to participate in medical holds. So if a person needs to be restrained for a medical procedure, our staff should not be involved in that. Hopefully you can point out that they are not there to be medical decision makers. They're there to provide, communication, behavioral, or ADL, IDL supports, but they are not there to guide a person's medical care or make choices about their medical care. And then the last thing I think I should mention is this might be sort of temporary. We have approval through the end of the public health emergency to do this, but before this can become permanent, and it will become permanent at some point, we have to make a change to the K plan, and that takes time. It's underway right now, but there is a possibility that the public health emergency will end before our K plan amendment is approved. So keep an eye out for changes to the K plan, updates to the K plan. The next update will include this, but again, there may be a gap. So just one thing to bear in mind.
Thanks, Mike.
Mm-hmm.
All right. Allison, would you like to talk to us a little bit about transportation?
Hi, yeah. On October 2nd, we issued a transmittal. It was IM 20-111. And it really was just stating existing practice. So it's nothing new. We just wanted to make sure people had the information that the community transportation budget tool is no longer required. And we've taken it down from the website. And that what you can do is the expenditure guidelines outlines the rates for DD 53. And using transportation. And then really also just clarifying that if you have questions, if provider agencies have an established rate, they can continue to use that and should until we can implement new rates that have been developed by Burns and Associates. Or if there's a significant change to a transportation rate, there's more people, it's a totally different route, that kind of thing, you can email us, and the email address is in the transmittal, requesting a recalculation of that rate. And I think that's about it.
Thanks, Allison. All right, so now is the time for any additional question over any topic that we covered today, or any topic that we didn't cover today. We are done pretty early, and there are a significantly smaller number of attendees at this month's meeting than it has been all year. I think, back to what Rose said, we're starting to settle into this horrible new normal, and maybe that's why there are fewer people. But if you have any questions, feel free to type them in and we will stick around and answer them. All right, guys, it's looking like there aren't any additional questions. So we will sign off. If you do have any other questions after today, feel free to send them to, let me pull that email back up for you. Oh, and there we go. Okay, so I just need to threaten to leave and we will get questions. Carrie is asking, she said yesterday there was a webinar about outbreaks in group homes. Was there any important takeaway from that? Shaylis, can you address this?
I sure can. So the Metro Area Public Health Office and Emergency Management, I'm not remembering their full term, they have pulled together and have begun doing weekly, I believe they're going to be weekly webinars with providers across all programs. I don't know what, Carrie, what your specific question is about it, but it was sponsored by Public Health, and I know that they asked one of our providers to share an experience about an outbreak that they had at the home and how they collaborated with the Public Health Office. So there's that summary in a nutshell.
Thanks, Shaylis.
Kirsten, is that answering the question? I don't see the question.
Yeah, I'm guessing so because she hasn't written back. But if Carrie, if that didn't answer your question, feel free to let us know and we will get to it in more in depth. Do we have any guidance, Shaylis? You probably don't want to unmute. Do we have any guidance for providers who travel? Should they self-quarantine before they work one-on-one with individuals? What do we say about that?
I'm actually going to stay unmuted and answer that. And they need to be working with their local public health office, especially if they're traveling outside of Oregon and outside of this the country, going into other countries. Really consulting with the public health office is going to be the best option, and even more so if you're traveling without the individuals you support.
Excellent, thank you. Hey, Shaylis, is there a link for that meeting that you were just talking about?
No, it's by invitation only. I shouldn't say by invitation only. Each county is sending out the information to their providers. Carrie, if you're in Multnomah, Washington, or Clackamas, then please connect with the program manager of those counties, and they're getting the information from the Washington and Multnomah County public health offices. There's a person in Washington and a person in Multnomah that are coordinating this together. So I only get, it's every week there's a new link and a new agenda with a new topic. So connect with your CDDP manager, please.
Thanks, Jaylus. I'm going to give it another minute, and then I'm going to threaten to shut down the meeting, and then we'll get a bunch of questions. Oh, Karen wanted to let you know that Columbia County is also now participating. So that might be another place to get info. Okay, everybody, thank you so very much for participating again this month. We will see you back here, same bat time, same bat channel, same kind of topics. We'll cover everything going on with COVID that is provider related. All right, guys, thank you so very much for being here. Have a great day. Oh, and happy Halloween.